For this chief complaint, parents come in and they say that their 4-year-old son is having these weird, funny eye movements. So, as a pediatric neurologist, I get the complaint of funny movements all the time. The first thing that comes to my mind are seizures, but I definitely need to know more of what the parents are seeing. They say that 3 days ago, they started noticing that their son was having these weird eye movements, almost like his eyes were dancing. At first, they thought that maybe it was just their kid being funny and silly, but the eyes were going back and forth, up and down, and they started to realize that it kept happening, and the child wasn't able to control what he was doing. The next day, they also started to notice that he was a little clumsy. He was walking, but kind of losing his balance, teeter-tottering around, and he started having these jerks of his arms and of his legs. That was very concerning to them, so they decided to bring him to the ED. So far, his parents have described these weird, chaotic eye movements that they're calling dancing, but also very troublesome to them and to the patient. They are describing these weird jerking of the arms and the legs. He's being really clumsy with his left hand, and then he's also falling over because he's not able to walk as well as he used to be able to walk. When they're telling me about all of these symptoms, I'm worried about something called opsoclonus, to the weird eye movements, myoclonus, the jerking, ataxia, unbalanced, unsteady gait syndrome. And usually when you think of opsoclonus, myoclonus, ataxia syndrome, sometimes that can be post-viral, post-infectious. He did have a cold a few days ago, but it could be something a lot worse. I am worried that this could be in the setting of cancer. Sometimes with opsoclonus, myoclonus, ataxia syndrome, it can be a paraneoplastic syndrome. When we say paraneoplastic, it's in the setting of a neoplasm, neoplastic, and essentially what's happening is that there's a tumor somewhere in the body's immune system is attacking itself, and sometimes that attack can even happen to the brain. And it already seems like he's having some function loss. His arm is more clumsy, and I'm worried that if we don't figure out what's going on, instead of his arm being clumsy, he might not be able to move his arm at all. He could continue to have neurologic devastation. It can get worse and worse. And ultimately, what's going on right now with his weird eye movements and the cerebellum being affected with the ataxia, his brainstem's being attacked. And you know what else the brainstem controls? Breathing. So I really need to figure out what's going on with this patient. So now that I've gotten the story from his parents, I really need to know from my standpoint what I'm seeing on his neurologic exam. And the reason I'm doing a physical exam is to figure out where in the brain this all could be happening or occurring from, but also just how is he doing in general. So overall, his vital signs are fine. There's no fever, so that makes it a little bit less likely that right now acutely he has an infection. But sometimes you can have an infection even if you don't have a fever. He's breathing normally, comfortably on room air, which is also good because I did mention that I'm worried that his brainstem could be affected, but at least he's breathing comfortably for now. And when I just check his mental status, I want to know, is he groggy, is he tired? But he's awake, he's alert, he's talking to me, he recognizes his parents, and these are all great signs because one thing I'm worried about is that could he be encephalopathic? Could he be having inflammation in the brain that can make him not aware and see what's going on around him? He's also able to follow commands, which is also a really great sign. Because of everything his parents said, I am worried about his cranial nerves. So when I look at his eye movements, they're right. His eye movements are going back and forth, up and down. It seems like he can't really control it at all. So when I look at his eyes, I see that the left pupil is smaller than the right pupil. And he does have that drooping of his left eyelid as well. All of these make me think about the sympathetic nervous system and how it's not working as well as it could be working. So on his exam, I also noticed that his left arm is weaker than his right arm, and he has decreased sensation on his left arm compared to the right arm as well. What's really interesting is that when I ask him to do finger, nose, finger, which is me looking at his coordination, he just uses his index finger, he touches his nose, he touches my index finger, he goes back to his nose. I see that he's not really able to touch my index finger when he uses his left index finger. Not only that, but then his finger tapping is slower on the left side. Now that I've heard the story from the parents, I've done my physical exam, I am really worried that he does indeed have a paraneoplastic syndrome. Why am I worried about this? When we think about weird eye movements and gait problems, what we're thinking about is the brainstem and the cerebellum. So that could be one area that could be affected. And when we were talking about the paraneoplastic syndrome, we were saying that it was the immune system attacking the brain. So the immune system could be attacking the cerebellum and the brainstem. So again, I'm really worried that we need to figure out what's going on so that the brainstem doesn't keep getting affected and we don't lose other vital functions like breathing. The other thing that I saw in exam is that he had that drooping left eyelid, his left pupil was constricted, and he also had decreased sweating on the left side. All of those tell me that his sympathetic nervous system is affected, and usually when we see that, that could mean that there's a tumor in the upper part of the spinal cord that's compressing on the nerves and the sympathetic ganglia to cause those symptoms. Why do I say the nerves? Because I also saw that his left arm was weaker and there was decreased sensation there, telling me that those nerves are being compressed. So those are all those constellation of signs make me think that indeed this is a tumor. This is in the setting of a neoplasm that is contributing to all these symptoms. But I can't anchor. I have to keep thinking about what else could be going on and how can we really decide and figure out what's going on for this 4-year-old boy. In terms of differential, even though I'm really worried about cancer and a tumor, I have to think about other things that could also be going on. It could be a stroke. He could have some type of vascular lesion that happened to cause that drooping of the left eyelid, decreased sensation and movement of the left arm. All of that could be in the setting of stroke. I think it's a little bit less likely because he is only 4 years old, but always it could be a possibility. He also doesn't have any other risk factors like heart problems to increase his risk of a stroke. Another thing on my differential is an infection or a post-infectious symptom. The parents did mention that he had the cold a few weeks ago, so maybe all of this is in the setting of his body recovering, and even sometimes in a post-infectious symptom, we could see weird eye movements, and maybe he's weak on the left side because he's still recovering from the cold. It's possible, I think it's less likely, but it is a possibility. The other thing, especially for a 4-year-old boy, is that it could be seizures. He could be having weird seizures that are causing his eyes to move weirdly, the jerks of his body to happen as well. All of that could be in the setting of seizures. So to figure out what's going on, I need imaging. I want to find the tumor if there is a tumor. And if there isn't a tumor, I want to rule that out completely. I'm going to image his entire brain. I also mentioned that I'm worried about his upper spine, so I'm going to image actually his entire spine. And because I'm worried that there's a tumor somewhere in the body that's causing this perineoplastic syndrome, I'm also going to image his chest and his abdomen to see where this tumor could be. So when we do the imaging, we do indeed see a tumor. And it's in a location in the upper spinal cord, which does explain why he was having that weakness and decreased sensation in his left arm. And interestingly, where the tumor was, it was compressing the sympathetic ganglia. And that's why we were seeing that drooping of the left eyelid, the constriction of the left pupil, and decreased sweating on the left side of his face as well. Next steps included him going for emergent surgery. We were really worried that where this tumor was, it could continue causing damage that could be permanent, where he wouldn't be able to use the left side of his body and he could start losing more function of his brainstem as well. So he went for emergent surgery with neurosurgery to be able to debulk this tumor and remove it, and he started chemotherapy with oncology.